Good morning and welcome to the Rules Committee. Today, the committee will consider H.R. 1628, the American Health Care Act of 2017. On March the 20th, 2010, the Rules Committee met in this very same room, of which I was a part of that meeting, and passed the Senate-crafted language in a House shell bill that will ultimately destruct and devastate our nation's health care system. The American people were promised by the President of the United States, who was so supportive of the bill that it even eventually took his own name. And his party and the bill would lower premiums by $2,500 per family per year. He promised the American people that if they liked their doctor, they could keep their doctor. He promised the American people that if they liked their health care plan, they could keep that also. He promised the American people that no family making less than $250,000 a year would see any form of tax increase when he became president. He promised the American people that Obamacare would mean more choice, more competition, and lower costs for millions of Americans. Now, 7 years later, almost to the day, it is abundantly clear that this Affordable Care Act, known as Obamacare, has failed the American people and the health care system and the people it was designed to help the most. As to the promises, premiums have increased by an average of 25% this year alone on the Obamacare exchanges, ruining the pocketbooks of American families and a far cry from the $2,500 reduction that they were promised for each family. At least 4.7 million Americans have been kicked off their preferred health care plans and had their coverage canceled due to Obamacare law. Despite the promise that if you liked your plan, you could keep your plan, and if you liked your doctor, you could keep your doctor. Obamacare contained $1 trillion in new taxes, mostly falling on families and job creators. Additionally, 18 of the 23 Obamacare co-ops have failed, costing taxpayers nearly $1.9 billion and forcing patients to have to scurry to find new alternatives for their health care. Obamacare has forced employees and employers to not only cut and lose their jobs, but to lay off employees now on a track that hurts American workers and their hours, an equivalent of at least 2 million jobs being lost. Simply put, Obamacare is collapsing right before the American people's eyes. Options and choices are disappearing for consumers, and an anti-competitive government-run market has been created that is leaving American patients, families, and business across this country desperate for answers. Nearly 1/3 of the United States counties currently have only one insurer offering exchange plans, and quite frankly, it is getting worse. That is not competition, and that's a government-run monopoly. Doctors also need a change. Patients need a change. Families need a change, and the American people are demanding a change, especially when they went to the ballot box in November. H.R. 1628, the American Health Care Act of 2017, eliminates Washington's one-size-fits-all health care plan. It dismantles the Obamacare taxes. It eliminates the individual employer mandates. It prohibits health insurers from denying coverage and helps young adults across the country to have access to health care while stabilizing and restoring a free market for all Americans. Most importantly, this legislation empowers individuals and families to make their own health care decisions. It helps low and middle income families across the country to have affordable quality care by providing monthly tax benefit that ensures parity to an unequal today marketplace. Americans deserve a competitive insurance marketplace that provides quality care at an affordable cost. For that reason, I'd like to welcome really the gentlemen and gentleladies who have been a part of the development of this plan, the architects of this legislation. From Hood River, Oregon, the gentleman Greg Walden, the chairman of the Energy and Commerce Committee, the gentleman from Texas, Montgomery County, Texas, Kevin Brady, who I came to Congress with, and the gentlewoman, Congressman Diane Black from Tennessee. Chairwoman, we're delighted that you're able to join us this morning on this first panel, as well as their ranking members. Thank you for being here today to complete our promise to the American people. I'd also like to welcome their panel of ranking members who are no strangers to the Rules Committee for their time before us. Obviously, the gentleman, Mr. Yarmouth, the gentleman, Mr. Pallone, the gentleman, Mr. Neal. Without objection to anything any of you have in writing will be entered to the record. Before I yield to the gentleman from Hood River, Oregon, I would like to defer to the ranking member of this committee.